Okay, today I'm going to attempt to show you how to put an NG tube down. And first you need to get the right kind. There are several different kinds, and let me just show you. These are the suctioning types, and this is the feeding type. Let me show you a little bit of a difference. The feeding tube tends to be thinner, it's more durable, it's more flexible, it's very soft because it needs to be less irritating because it's in there for a long time. It has a black X-ray detectable end, and to guide it down, if I was to be able to pull this out, there is a stylet, which is a guide wire. So once it's down and once you pull the guide wire out, you do not want to insert the guide wire because you don't want to puncture the edge or puncture the patient. This is your feeding tube, so we're going to lay it aside. This is just another suction tube. This has two openings or luminas. This one right here, this little blue one, sometimes it comes in purple. It's called a pigtail, and your pigtail is used only for an air vent or connector, so it will tend to work a little bit better. So you don't put anything down this one or take anything out. Everything goes down your main one right here. And this is very similar to it, except that it doesn't have two openings or two luminas. So what we will do, I'll just use this one right here, is we're going to measure first to see how far it goes down the patient. So we take the end of it, we put it up to the nose, we don't put it on the patient. We measure from nose to ear to xiphoid process, and at that point we'll get a piece of tape and tape it right here. And a lot of these are marked. See, this has a little mark, a little black mark right here about where it needs to be. So we know it needs to go to this black mark here. To get your patient into position, they need to be in high Fowler's position. You need to put the tube into the less deviated nostril, so the one that it looks like it's going to go down the most. And if both are about the same, I'd say put it in the nostril closest to you. The thing that works the best is to, when you are actually getting it down, their chin needs to be down to their chest so it will open up their throat. And you need lots of lubrication on the end of this. Another thing too is once you get it past the resistance, if they can drink, you take a glass of water and let them sip, and as they drink, push it down. So to recap, you want to measure it from nose to ear to xiphoid process, set them up in a high Fowler's position, largest nostril, lots of lubrication, and you want to put it in the nostril. Once you get it past the hard part here where it bends, the resistance, then it's going to be a lot easier. Once you feel past the resistance, you go ahead and let them take a sip. And when they sip, you push. When they sip, you push. When they sip, you push. All the way down to the little black dot, okay? That way it should be past their gag reflex, and they should feel it in the back of the throat, but it's not terribly irritating. Then you can let them lay back a little bit, and you also need to check it for placement. So if you see this little line right here, this also is picked up on X-ray. One way of checking for placement, which is probably the least effective, is to get some air in your syringe, get a stethoscope, and push your air in and listen with your stethoscope to the stomach, and you'll hear it gurgling. Not terribly effective, but it is done, and a lot of people would say it's better than nothing. Another way, after it's set for a while, would be to come and pull out, and you can actually pull out secretions. And it's not necessary to pull out secretions into the tube, right into the syringe here. You can pull it into the tube and see that it's stomach secretions. Or the best way is X-ray, because you know that it's in the right place. And when you hook it up to suction, you want to hook it up on your main port here, so you want to hook it up like this. If you hear the word gavage, that means you are giving something to the patient, feeding something to the patient. If you lavage a patient, that means you're suctioning them out. And then up here you need to go ahead and tape it to the nose and make sure that it's secure up here. A lot of times you can also get a piece of tape and then maybe a safety pin, and tape it to the gown right here with a little bit of flexion so it's not pulling tight like this. Make sure you're aware of how the patient looks. If you have some some oil up here that keeps the tape from sticking, that you'll go ahead and wipe the oil off and make them look as good as possible. If you have a patient who has an NG and they're on permanent suction, your suction machine is on like this and it's just suctioning out. If you give them a PO medicine, that's a medicine by mouth, then your problem would be that it's going to suck your medicine out. So a better way to do it would be to turn off your suction machine, to document that, and let it stay off until your medication is absorbed. Or even better than that, give it a different route. You can call a doctor, change the route, and as you change the route, you change the way it's given. You don't give it pill form in an IV. You give it a totally different way. So you can give it IV, IM, suppository, patch, several different ways or methods. And that's probably the best way that you give it. A couple things you need to be aware of is you need to establish a wait a minute signal, like have the patient hold their hand up if they need for you to stop, because this is pretty traumatic on patients and their lacrimal tear ducts tend to run a little bit and it's very uncomfortable. So establish a wait a minute sign so they're okay. And this is basically how you put it in. It's not complicated, it's just uncomfortable for the patient. But if you are good, two things you should really remember and stick it in your brain. Lots of lubrication to go down past the resistance and the patient's chin to the chest to get it down in their throat. The way you can remember this is bend your head back and try to swallow. It's really hard, but if you bend your head forward and swallow, it's really easy because it opens it up. So this is your NG instruction.